Question 1. The evaluation methodology shows that a patient, who is a carrier for a recessive genetic condition, requests genetic testing to confirm their carrier status before starting a family. The patient expresses concern about how this information might affect their relationship with their parents, who have a history of being highly anxious about health matters. The genetic counselor must determine the most ethically sound and professionally appropriate course of action, adhering strictly to the regulatory framework and guidelines of the American Board of Medical Genetics and Genomics. Option A. Proceed with the genetic testing as requested, after a comprehensive discussion with the patient about the potential implications of the results for their family, and offer appropriate psychosocial support and resources for managing family dynamics. Option B. Perform the genetic testing immediately without further discussion, assuming the patient has fully considered all potential family impacts. Option C. Decline the genetic testing, explaining to the patient that the potential for family distress outweighs the benefits of confirming carrier status at this time. Option D. Recommend genetic testing for the patient's parents first to assess their carrier status before proceeding with the patient's request. The correct answer is A. Proceed with the genetic testing as requested, after a comprehensive discussion with the patient about the potential implications of the results for their family, and offer appropriate psychosocial support and resources for managing family dynamics. Explanation. This scenario presents a professional challenge due to the inherent tension between a patient's expressed desire for genetic information and the potential for that information to cause significant distress or be misinterpreted by family members who are not directly involved in the decision-making process. The genetic counselor must navigate these competing ethical principles, particularly autonomy, beneficence, and non-maleficence, within the established regulatory framework of the American Board of Medical Genetics and Genomics, (ABG). The correct approach prioritizes patient autonomy while also upholding the principles of beneficence and non-maleficence. By engaging in a thorough discussion about the implications of the genetic test results for the patient and their family, and by offering appropriate support and resources, the genetic counselor acts in accordance with ABG guidelines that emphasize informed consent, patient well-being, and the responsible dissemination of genetic information. This approach respects the patient's right to make decisions about their own health information, while mitigating potential harm to themselves and their family. An incorrect approach that proceeds with testing without fully exploring the patient's understanding of the implications for their family, or without offering adequate psychosocial support, fails to uphold the principle of beneficence by not ensuring the patient is fully prepared for the potential consequences of the results. It also risks violating non-maleficence by potentially causing undue distress to the patient or their family due to a lack of preparedness or understanding. Another incorrect approach, which involves unilaterally deciding not to test based on assumptions about family impact, infringes upon patient autonomy and may be seen as paternalistic, contradicting the ethical imperative to respect a patient's right to self-determination. A third incorrect approach, which focuses solely on the technical aspects of the test without adequately addressing the psychosocial and familial implications, neglects the holistic nature of genetic counseling and the potential for harm beyond the individual. Professional decision-making in such situations requires a systematic process. First, clearly identify the ethical principles in conflict. Second, gather all relevant information, including the patient's values, family dynamics, and potential risks and benefits. Third, consult relevant ABG guidelines and ethical codes. Fourth, engage in open and honest communication with the patient, exploring their understanding and concerns. Fifth, collaboratively develop a plan that respects patient autonomy while maximizing benefit and minimizing harm. And finally, document the decision-making process thoroughly. Question 2. To address the challenge of accurately assessing recurrence risk for a suspected autosomal recessive condition in a family where the pedigree shows some individuals who are carriers but do not exhibit the full phenotype, which approach best optimizes the genetic counseling process? Option A. Conduct a comprehensive pedigree analysis, considering potential reduced penetrance or variable expressivity, and calculate recurrence risks based on the most likely Mendelian inheritance pattern, while clearly communicating the uncertainties. Option B. Assume the condition is not autosomal recessive if the pedigree does not perfectly match textbook examples of autosomal recessive inheritance. Option C. Provide a general carrier risk percentage for the population without detailed family-specific risk calculations. Option D. Focus solely on the phenotype of the immediate family members and disregard the history of more distant relatives. The correct answer is A. Conduct a comprehensive pedigree analysis, considering potential reduced penetrance or variable expressivity, and calculate recurrence risks based on the most likely Mendelian inheritance pattern, while clearly communicating the uncertainties. Explanation. Scenario analysis. This scenario presents a professional challenge in genetic counseling, where a clinician must interpret complex Mendelian inheritance patterns in the context of a family history that may not perfectly align with textbook examples. The challenge lies in accurately assessing recurrence risk for a potentially autosomal recessive condition, given incomplete penetrance or variable expressivity, while adhering to the ethical and regulatory standards of genetic practice in the United States, as governed by bodies like the American Board of Medical Genetics and Genomics, (ABM). Misinterpretation can lead to significant anxiety for the family, inappropriate medical management, and potential legal or ethical repercussions. The need for precise risk assessment and clear communication is paramount. Correct approach analysis. The correct approach involves a thorough review of the family history, considering the possibility of reduced penetrance or variable expressivity, and then applying the principles of autosomal recessive inheritance to calculate the most accurate recurrence risk. This aligns with ABM guidelines emphasizing evidence-based practice and patient-centered counseling. Specifically, it requires understanding that if a condition is autosomal recessive, unaffected individuals who are carriers have a 25% chance of having an affected child with another carrier. When penetrance is incomplete, the observed phenotype may not always reflect the genotype, necessitating a careful assessment of all available family data to refine risk estimates. This approach prioritizes accurate genetic assessment and informed decision-making for the family, upholding professional standards of care. Incorrect approaches analysis. One incorrect approach would be to dismiss the possibility of an autosomal recessive condition solely because the pedigree does not perfectly fit the expected pattern, without considering factors like reduced penetrance or variable expressivity. This fails to adhere to the principle of comprehensive genetic assessment and could lead to underestimation of risk. Ethically, it breaches the duty to provide thorough and accurate genetic information. Another incorrect approach would be to provide a generalized risk without a detailed pedigree analysis, such as stating a generic carrier risk without considering the specific family's reproductive history and the potential impact of incomplete penetrance. This lacks the specificity required for effective genetic counseling and could mislead the family about their actual risk. This is a failure in providing individualized risk assessment, a core tenet of genetic counseling. A third incorrect approach would be to focus solely on the most recent generation's phenotype without considering the broader family history and the potential for carrier status in unaffected relatives. This overlooks crucial information that could inform the genetic diagnosis and risk assessment, potentially leading to an inaccurate conclusion about the mode of inheritance or recurrence risk. This demonstrates a lack of thoroughness in pedigree analysis, which is fundamental to Mendelian genetics. Professional reasoning. Professionals should approach such scenarios by first meticulously constructing and reviewing the family pedigree, identifying all affected and unaffected individuals and their relationships. They should then consider the most likely modes of inheritance based on the observed pattern, while simultaneously evaluating potential explanations for deviations from typical inheritance, such as reduced penetrance, variable expressivity, new mutations, or misattributed paternity. The next step is to calculate recurrence risks for each plausible mode of inheritance, using appropriate statistical methods and considering any available genetic testing results. Finally, the clinician must communicate these risks clearly and empathetically to the family, discussing the implications for future reproductive decisions and offering appropriate support and further management options, all within the ethical framework of patient autonomy and beneficence. Question 3. Analysis of a patient presenting with a family history of a rare disorder. The genetic counselor is tasked with explaining the inheritance pattern. The patient's mother exhibited mild symptoms, while their father was unaffected. However, the patient's sibling displays a more severe presentation of the disorder than the mother. Considering these observations, which of the following explanations best aligns with the principles of accurate genetic counseling and patient understanding of inheritance patterns, particularly when distinguishing between codominance and incomplete dominance? Option A. focusing on the fact that since the father is unaffected, the disorder must be recessive, and the mother's mild symptoms are an anomaly. Option B, stating that the disorder is strictly Mendelian dominant, and the differing symptom severity is likely due to incomplete penetrance. Option C, describing the disorder as codominant, where both alleles are fully expressed in the heterozygote, and the observed variations are simply due to random chance in gene expression. Option D, explaining that the disorder follows incomplete dominance, where the heterozygous state results in an intermediate phenotype, and the varying severity in family members could be due to other genetic or environmental modifiers. Correct answer is D, explaining that the disorder follows incomplete dominance, where the heterozygous state results in an intermediate phenotype, and the varying severity in family members could be due to other genetic or environmental modifiers. Explanation: this scenario presents a professional challenge because it requires a genetic counselor to accurately explain complex inheritance patterns to a patient, ensuring comprehension and informed decision-making. The challenge lies in translating abstract genetic concepts like codominance and incomplete dominance into understandable terms, especially when a patient may have limited prior knowledge. The counselor must also navigate the potential emotional impact of genetic information and ensure the patient's autonomy is respected. The correct approach represents best professional practice by prioritizing patient education and clear communication, aligning with the ethical principles of beneficence and autonomy. Specifically, it adheres to guidelines that mandate genetic counselors provide comprehensive and understandable information about inheritance patterns, potential outcomes, and implications for family members. This approach ensures the patient can make informed decisions about genetic testing, reproductive options, or management strategies based on accurate genetic knowledge. It also reflects the professional standard of care in medical genetics, which emphasizes patient-centered communication and shared decision-making. An incorrect approach that focuses solely on the Mendelian definition of dominance without acknowledging the nuances of codominance or incomplete dominance would be a regulatory and ethical failure. This would violate the principle of providing accurate and complete information, potentially leading to patient misunderstanding and misinformed decisions. Another incorrect approach that oversimplifies the genetic explanation to the point of being misleading, or one that fails to address the implications for family members, would also constitute a failure. Such approaches neglect the counselor's duty to provide thorough genetic counseling and could lead to inadequate risk assessment for relatives. Furthermore, an approach that imposes a particular course of action on the patient, rather than facilitating their informed choice, would violate the principle of patient autonomy and ethical guidelines on informed consent. Professionals should employ a decision-making framework that begins with assessing the patient's current understanding of genetics. This is followed by tailoring the explanation of inheritance patterns, using clear analogies and visual aids where appropriate, to illustrate codominance and incomplete dominance. The framework necessitates discussing the phenotypic expression in heterozygotes for both patterns and exploring the implications for family members and future generations. Crucially, the framework involves active listening, encouraging questions, and confirming comprehension throughout the counseling session, ensuring the patient feels empowered to make informed decisions. Question 4. The monitoring system demonstrates a significantly elevated allele frequency for a specific autosomal recessive disorder in a geographically isolated community. Genetic analysis reveals a cluster of closely related haplotypes associated with the disease-causing variant. Historical records indicate a period of severe population decline, followed by a subsequent expansion from a small number of survivors. Which of the following interpretations best explains the observed genetic pattern? Option A. The elevated allele frequency is primarily due to a bottleneck effect, where a past severe population reduction drastically increased the relative frequency of pre-existing variants. Option B. The elevated allele frequency is primarily due to a founder effect, where a small group of individuals carrying the variant established the current population. Option C. The elevated allele frequency is solely attributable to recent de novo mutations, occurring at a high rate within the community. Option D. The elevated allele frequency is a result of ongoing genetic drift in a large, stable population with no significant historical events. The correct answer is B. The elevated allele frequency is primarily due to a founder effect, where a small group of individuals carrying the variant established the current population. Explanation. This scenario presents a professional challenge because it requires the geneticist to interpret population-level genetic data within the context of a specific, potentially isolated community. The challenge lies in distinguishing between the effects of founder events and bottleneck events, both of which can lead to increased allele frequencies of certain genetic variants, including those associated with disease. Accurate interpretation is crucial for providing appropriate genetic counseling, risk assessment, and potential screening strategies to the community. The geneticist must consider the historical population dynamics and the specific genetic architecture of the observed variants. The correct approach represents best professional practice because it involves a comprehensive evaluation of the available genetic data in conjunction with known population history. This includes analyzing the allele frequencies of specific variants, assessing their distribution within the population, and considering the potential impact of historical events like migration or population reduction. By integrating these factors, the geneticist can more accurately determine the most likely evolutionary forces at play and their implications for disease risk. This aligns with the ethical obligation to provide accurate and evidence-based information to patients and communities, as mandated by professional guidelines that emphasize thoroughness and scientific rigor in genetic interpretation. An incorrect approach that focuses solely on the current high allele frequency of a specific variant, without considering its historical context, is professionally unacceptable. This failure to investigate the underlying population dynamics can lead to misattribution of the cause of the high frequency, potentially overlooking critical factors like a severe bottleneck that might have implications for overall genetic diversity beyond the variant of interest. Such an oversight could result in incomplete or misleading genetic counseling, failing to meet the standard of care. Another incorrect approach would be to assume a founder effect without sufficient evidence of a small initial founding population or subsequent isolation. This can lead to an oversimplification of the genetic landscape and may not account for other evolutionary pressures that could have contributed to the observed allele frequencies. This lack of rigorous investigation into the population's history represents a failure to adhere to the principles of sound genetic analysis and can lead to inaccurate conclusions. Finally, an approach that dismisses the possibility of both founder and bottleneck effects due to the current population size alone is also flawed. Population size at a given moment does not negate the historical impact of past bottleneck or founder events, which can have lasting effects on allele frequencies and genetic diversity. This demonstrates a misunderstanding of population genetics principles and a failure to apply a comprehensive analytical framework. The professional decision-making process for similar situations should involve a systematic evaluation of population genetic data, historical context, and the specific genetic variants of interest. This includes 1. Characterizing the allele frequencies and their distribution. 2. Investigating historical population events, e.g., migration, isolation, population size fluctuations. 3. Considering the mode of inheritance and potential selective pressures on the variants. And 4. Integrating all findings to provide the most accurate and nuanced interpretation, which then informs genetic counseling and clinical management. Question 5. Benchmark analysis indicates that a clinical geneticist is reviewing Sanger sequencing results for a patient presenting with a complex neurological disorder. The analysis of the relevant gene reveals 3 distinct variants: a rare variant with no prior reports in public databases, a missense variant predicted to be deleterious by multiple in silico tools, but not yet observed in affected individuals, and a previously reported pathogenic variant in a different exon of the same gene. Which approach best reflects current best practices for reporting these findings to guide patient management? Option A. Report all 3 variants as potentially contributing to the patient's phenotype, emphasizing the need for further research to clarify their individual roles. Option B. Report the novel variant as the likely cause of the patient's condition due to its rarity and the absence of prior reports, while deferring comment on the other variants. Option C. Classify the missense variant as pathogenic based on the in silico predictions, as this is a strong indicator of functional impact. Option D. Prioritize reporting the previously documented pathogenic variant as the cause of the patient's condition, while noting the presence of the other variants as incidental findings, or VUS, requiring further investigation. The correct answer is B. Report the novel variant as the likely cause of the patient's condition due to its rarity and the absence of prior reports, while deferring comment on the other variants. Explanation. Scenario analysis. This scenario presents a common challenge in clinical genetics. Interpreting Sanger sequencing results for a patient with a suspected genetic disorder where multiple variants are identified. The professional challenge lies in accurately determining the pathogenicity of these variants, especially when they are novel or have limited prior annotation. This requires a systematic approach that integrates multiple lines of evidence and adheres to established guidelines, balancing the need for timely diagnosis with the imperative of diagnostic accuracy and patient safety. The presence of variants of uncertain significance, VUS, is particularly problematic, as misclassification can lead to inappropriate clinical management, unnecessary anxiety for patients and families, and potential downstream testing or interventions. Correct approach analysis. The correct approach represents best professional practice by adhering to the ACNG/AMP guidelines for variant interpretation. This systematic process involves evaluating variant frequency in control populations, conservation across species, predicted impact on protein function, using in silico tools, segregation with disease in affected individuals if available, and literature review for similar variants. Crucially, it emphasizes the need for robust evidence to classify a variant as pathogenic or likely pathogenic before reporting it as the cause of a patient's condition. This aligns with the ethical principle of beneficence, ensuring that diagnostic information provided to the patient is accurate and actionable, and the principle of non-maleficence, by avoiding the reporting of unconfirmed findings that could lead to harm. The emphasis on a multifaceted evidence-based approach is also implicitly supported by the regulatory expectation for laboratories to maintain high standards of quality and accuracy in genetic testing, as overseen by bodies like the CAP College of American Pathologists and CLIA, Clinical Laboratory Improvement Amendments, in the U.S., which mandate rigorous quality control and proficiency testing. Incorrect approaches analysis. Reporting a variant solely based on its presence in a gene known to be associated with the patient's phenotype, without further functional or segregation data, represents a significant regulatory and ethical failure. This approach bypasses the established variant classification framework and risks overinterpreting incidental findings or misattributing pathogenicity. It violates the principle of diagnostic accuracy and could lead to a false positive diagnosis, causing undue distress and potentially leading to inappropriate medical interventions. Classifying a variant as pathogenic based only on a single in silico prediction tool, even if it suggests a deleterious effect, is also professionally unacceptable. While in silico tools are valuable components of variant interpretation, they are not definitive. Reliance on a single tool without corroborating evidence from other sources, e.g., population frequency, conservation, experimental data, fails to meet the standard of evidence required by professional guidelines and regulatory oversight. This can lead to a false positive classification, with the same negative consequences as described above. Prioritizing the reporting of novel variants over well-established pathogenic variants in the same gene, simply because they are novel, is a flawed strategy. The novelty of a variant does not inherently confer pathogenicity. The primary goal of genetic testing is to identify the cause of the patient's condition, regardless of whether the variant is previously described or novel. This approach risks overlooking a known pathogenic variant while pursuing a speculative finding, thereby delaying or preventing an accurate diagnosis and violating the principles of diagnostic accuracy and patient care. Professional reasoning. Professionals should approach variant interpretation with a systematic, evidence-based methodology. This involves 1. Understanding the patient's phenotype and the genetic basis of suspected disorders. 2. Performing a thorough literature search and database query for known variants in relevant genes. 3. Applying the ACNG/AMP guidelines for variant classification, systematically evaluating all available evidence. 4. Recognizing the limitations of individual evidence types and the importance of corroboration. 5. Clearly documenting the interpretation process and the evidence supporting each classification. 6. Communicating findings clearly and accurately to the referring clinician, including any variants of uncertain significance and their implications. 7. Staying abreast of evolving guidelines and new scientific literature in the field of medical genetics. Question 6. Process analysis reveals that a patient presents with a complex medical history and a family history suggestive of inherited conditions. Genetic testing identifies a de novo paracentric inversion of chromosome 12 in the patient. The inversion is confirmed to be balanced and does not appear to be directly associated with the patient's current phenotype based on current literature. However, the patient is considering future reproductive plans. Which of the following approaches best represents the professional responsibility in this situation? Option A. Counsel the patient on the implications of a balanced paracentric inversion for future reproductive risks, including the potential for unbalanced rearrangements in offspring, and discuss available options for reproductive planning and prenatal diagnosis while respecting their autonomy and values. Option B. Immediately refer the patient to a reproductive endocrinologist to manage all future reproductive decisions without further genetic counseling regarding the specific implications of the inversion. Option C. Advise the patient to avoid any future reproductive endeavors due to the presence of a chromosomal abnormality, regardless of its balanced nature or potential impact. Option D. Inform the patient that since the inversion is balanced and not directly linked to their current phenotype, it is of no further clinical significance and no further discussion is needed regarding reproductive implications. The correct answer is A. Counsel the patient on the implications of a balanced paracentric inversion for future reproductive risks, including the potential for unbalanced rearrangements in offspring, and discuss available options for reproductive planning and prenatal diagnosis, while respecting their autonomy and values. Explanation. Scenario analysis. This scenario is professionally challenging because it involves interpreting complex genomic data, structural abnormalities, in the context of a patient's clinical presentation and family history. The genetic counselor must balance the need for accurate genetic information with the potential for significant emotional, social, and medical implications for the patient and their family. The presence of a balanced translocation in a parent, while not directly causing a phenotype in that parent, carries a risk of unbalanced rearrangements in offspring, necessitating careful risk assessment and counseling. The challenge lies in translating complex cytogenetic findings into understandable information and guiding the patient through difficult reproductive and medical decisions. Correct approach analysis. The correct approach involves a comprehensive review of the patient's and family's medical and genetic history, correlation of the identified structural abnormality, e.g., a paracentric inversion with the patient's phenotype, and an assessment of the reproductive risks for future offspring. This aligns with the American Board of Medical Genetics and Genomics, ABME competency domains, particularly in the areas of clinical genetics, genetic counseling, and ethical considerations. The professional practice is to provide accurate, evidence-based information, discuss potential implications, and empower the patient to make informed decisions. This includes exploring options such as prenatal diagnosis or preimplantation genetic testing, if applicable and desired by the patient, while respecting their autonomy and values. The focus is on patient-centered care and shared decision-making, adhering to ethical guidelines that prioritize patient well-being and confidentiality. Incorrect approach is analysis. An approach that focuses solely on the presence of the structural abnormality without considering its potential clinical significance or reproductive implications is ethically and professionally deficient. For example, dismissing a balanced translocation as benign without discussing the associated risks for offspring would be a failure to provide complete genetic counseling. This violates the principle of beneficence by not fully informing the patient of potential risks. Another incorrect approach would be to provide definitive prognoses or make decisions for the patient without their input. This infringes upon patient autonomy and the principle of informed consent. For instance, strongly advising against a particular reproductive choice based solely on the genetic finding, without exploring the patient's preferences and values, is inappropriate. Furthermore, failing to consider the family context and potential implications for other family members, while respecting confidentiality, can also be problematic. If the structural abnormality has implications for other relatives, the genetic counselor has a responsibility to discuss options for cascade testing or information sharing in accordance with ethical guidelines and patient consent. Professional reasoning. Professionals should approach such cases by first gathering all relevant clinical and genetic information. This includes detailed family history, physical examination findings, and all available genetic test results. The next step is to synthesize this information to understand the potential impact of the structural abnormality on the patient's health and reproductive potential. This involves consulting relevant literature and databases to assess the known clinical associations of the specific abnormality. Crucially, the professional must then engage in open and empathetic communication with the patient, explaining the findings in clear, understandable terms, and discussing the implications, uncertainties, and available options. This process should be collaborative, respecting the patient's values, beliefs, and decision-making capacity. Ethical consideration, including confidentiality, autonomy, beneficence, and non-maleficence, must guide every step of the process. Question 7. Risk assessment procedures indicate that a couple has a child with Down syndrome due to a Robertsonian translocation between chromosomes 14 and 21, inherited from the mother. The mother's karyotype confirms she is a balanced carrier. What is the most appropriate approach to counseling this couple regarding their future reproductive risks? Option A. Provide a general recurrence risk for chromosomal abnormalities in future pregnancies, without detailing the specific translocation mechanism. Option B. Explain the specific recurrence risk for Down syndrome due to the maternal Robertsonian translocation, detailing the potential segregation patterns of the translocation during meiosis and the resulting gametes. Option C. Focus solely on prenatal diagnostic options for the current pregnancy, without discussing recurrence risks for future pregnancies. Option D. Advise the couple to pursue adoption as the primary option for building their family, given the identified genetic risk. The correct answer is B. Explain the specific recurrence risk for Down syndrome due to the maternal Robertsonian translocation, detailing the potential segregation patterns of the translocation during meiosis and the resulting gametes. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a genetic counselor to interpret complex cytogenetic findings in the context of a patient's reproductive history and potential future risks. The challenge lies in accurately assessing the recurrence risk of a specific chromosomal aberration, explaining it clearly to the patient, and guiding them through available options, all while adhering to the ethical principles and regulatory guidelines governing genetic services in the United States, as mandated by the American Board of Medical Genetics and Genomics (ABM) framework. The counselor must balance scientific accuracy with patient autonomy and informed consent. Correct approach analysis. The correct approach involves a thorough review of the patient's karyotype and the specific chromosomal aberration identified. This includes understanding the mechanism by which the aberration arose, e.g., parental translocation, de novo event, and its associated recurrence risk. Best professional practice, aligned with ABM guidelines and U.S. regulatory expectations for genetic counseling, dictates providing accurate, evidence-based information about the specific aberration, its implications for the current pregnancy and future pregnancies, and the available diagnostic and management options. This approach prioritizes patient understanding and informed decision-making, ensuring that the patient can make choices aligned with their values and goals. Ethical considerations, such as beneficence and non-maleficence, are met by providing comprehensive and accurate risk assessment. Incorrect approaches analysis. One incorrect approach would be to provide a generalized recurrence risk for chromosomal abnormalities without specifying the particular aberration or its mechanism. This fails to meet the standard of care for genetic counseling, as it lacks the specificity required for informed decision-making and could lead to patient anxiety or misinterpretation of risk. Ethically, this approach could be seen as a failure of beneficence by not providing the most relevant and accurate information. Another incorrect approach would be to focus solely on the immediate pregnancy outcome without discussing the implications for future reproductive planning or the potential for parental carrier status. This is a failure to provide comprehensive genetic counseling, which should encompass both current and future reproductive risks. Regulatory guidelines emphasize a holistic approach to genetic counseling, addressing all relevant aspects of the genetic condition. A third incorrect approach would be to recommend specific medical interventions without fully exploring the patient's preferences and values, or without adequately explaining the risks and benefits of each option. This infringes upon patient autonomy and the principle of informed consent, which are cornerstones of ethical medical practice in the U.S. The ABM framework emphasizes empowering patients to make their own decisions. Professional reasoning. Professionals should approach such situations by first meticulously reviewing the patient's genetic data and relevant literature to understand the specific chromosomal aberration and its etiology. This is followed by a clear and empathetic communication of the findings, including the mechanism of the aberration, the estimated recurrence risk, and the implications for the current and future pregnancies. The counselor must then present all available diagnostic and management options, ensuring the patient understands the risks, benefits, and limitations of each. Throughout this process, the professional must remain neutral, support patient autonomy, and adhere to all applicable U.S. regulations and ethical guidelines for genetic services. Question 8. Regulatory review indicates that a clinical geneticist has received a comprehensive NGS report for a patient presenting with a complex multisystem disorder. The report identifies several variants in genes associated with various conditions, some of which are well established, while others are novel or have uncertain clinical significance. The geneticist must determine the most appropriate course of action for patient management and reporting, adhering to U.S. regulatory frameworks and ethical guidelines. Which of the following approaches best reflects professional best practice in this scenario? Option A. Prioritize reporting and acting upon variants with established clinical significance, while deferring interpretation and reporting of novel or uncertain variants until further research or consensus emerges. Option B. Rely exclusively on the interpretation provided by the NGS laboratory, assuming their analysis is definitive and requires no further clinical validation or correlation by the ordering physician. Option C. Immediately report all identified variants to the patient and referring physician, regardless of their current clinical significance or the potential for misinterpretation, to ensure complete disclosure of all genomic data. Option D. Conduct a thorough clinical correlation of all identified variants, consult relevant databases and literature to assess their significance, and integrate these findings with the patient's phenotype to guide clinical recommendations and reporting. The correct answer is A. Prioritize reporting and acting upon variants with established clinical significance, while deferring interpretation and reporting of novel or uncertain variants until further research or consensus emerges. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the rapid advancement of NGS technology with the established regulatory oversight designed to ensure patient safety and data integrity. The clinician must navigate the complexities of interpreting novel findings, understanding the limitations of current diagnostic standards, and communicating potential implications to patients and referring physicians, all within the framework of existing U.S. regulations governing genetic testing and clinical diagnostics. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a thorough, evidence-based interpretation of the NGS findings. This involves consulting established databases, peer-reviewed literature, and expert consensus guidelines to assess the clinical significance of identified variants. It aligns with the U.S. regulatory framework, particularly the Food and Drug Administration's FDA oversight of laboratory-developed tests, LDT, and the Centers for Medicare and Medicaid Services, CMS, Clinical Laboratory Improvement Amendments, CLIA regulation, which mandate accurate and reliable testing. Ethically, it upholds the principle of beneficence by ensuring that patient care is guided by the most accurate and relevant information, and it respects patient autonomy by providing clear, evidence-based explanations. Incorrect approaches analysis. One incorrect approach involves immediately reporting all identified variants, regardless of their known clinical significance or the limitations of the assay. This fails to meet the regulatory requirement for accurate and clinically validated reporting. It can lead to patient anxiety and unnecessary medical interventions based on incidental or uncertain findings, violating ethical principles of non-maleficence and patient autonomy. Another incorrect approach is to dismiss findings that are not yet widely published or recognized by major professional bodies. While caution is warranted, this can lead to misdiagnoses or underestimation of risk, potentially harming patients who could benefit from early intervention or genetic counseling. This approach may not fully comply with the spirit of providing comprehensive diagnostic information as expected under CLIA. A third incorrect approach is to rely solely on the interpretation provided by the NGS laboratory without independent clinical correlation or consideration of the patient's specific phenotype. While laboratories provide valuable data, the ultimate responsibility for clinical interpretation and patient management rests with the ordering physician. This can lead to misdiagnosis or inappropriate management decisions, failing to meet the standard of care and potentially violating regulatory expectations for physician oversight. Professional reasoning. Professionals should adopt a systematic approach. 1. Understand the specific NGS assay's capabilities and limitations. 2. Correlate identified variants with the patient's clinical presentation and family history. 3. Consult reputable databases, e.g., ClinVar, HGMD, and peer-reviewed literature for variant interpretation. 4. Engage with the performing laboratory for clarification on their interpretation methodology. 5. Consider the need for confirmatory testing if indicated. 6. Communicate findings clearly and comprehensively to the patient and referring physician, including any uncertainties. This process ensures adherence to regulatory standards, FDA, CLIA, and ethical obligations. Question 9. Strategic planning requires a genetic counselor to assess the reproductive risk for a couple where both partners have a family history suggestive of an autosomal recessive condition, but neither has been diagnosed with the condition themselves, and no specific genetic testing has been performed. Which approach best facilitates informed reproductive decision-making for this couple? Option A. Advise the couple that since neither partner is affected, the risk of having an affected child is negligible, and no further genetic evaluation is necessary. Option B. Thoroughly review both partners' family histories, explain the principles of autosomal recessive inheritance, and discuss the benefits and limitations of carrier screening for both individuals to determine their potential carrier status and associated reproductive risks. Option C. Focus the genetic counseling solely on the absence of affected individuals in their immediate nuclear families, concluding that carrier status is unlikely. Option D. Immediately recommend prenatal diagnosis for any future pregnancies, as the family histories suggest a potential for an affected child. The correct answer is B. Thoroughly review both partners' family histories, explain the principles of autosomal recessive inheritance, and discuss the benefits and limitations of carrier screening for both individuals to determine their potential carrier status and associated reproductive risks. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a genetic counselor to navigate the complexities of autosomal recessive inheritance risk assessment for a couple with a shared family history of a genetic condition, without direct knowledge of the specific mutation. The challenge lies in providing accurate, actionable risk information while respecting patient autonomy and adhering to professional ethical guidelines, particularly concerning the implications of carrier testing and potential reproductive decisions. The absence of definitive carrier status for either partner necessitates a nuanced approach to risk communication. Correct approach analysis. The correct approach emphasizes a comprehensive genetic counseling process that includes detailed family history taking, explanation of autosomal recessive inheritance patterns, and discussion of carrier testing options for both partners. This aligns with the American Board of Medical Genetics and Genomics (ABM) competency domains, which include genetic assessment, counseling, and communication. Specifically, it reflects the ethical obligation to provide accurate risk information, discuss available diagnostic and carrier testing, and support informed decision-making. This approach prioritizes patient education and empowerment, ensuring the couple understands the implications of their genetic information for their reproductive planning. Incorrect approaches analysis. One incorrect approach focuses solely on the absence of a known, affected relative in the immediate family, leading to an underestimation of risk. This fails to acknowledge that autosomal recessive conditions can be present in carrier states within families without overt expression, and that carrier screening is crucial for accurate risk assessment. Ethically, this approach risks providing incomplete or misleading information, potentially leading to poor reproductive choices. Another incorrect approach involves immediately recommending prenatal diagnosis without first establishing carrier status for the parents. This bypasses essential steps in the risk assessment process, such as carrier screening, and may be premature and anxiety-provoking for the couple. It also fails to respect the principle of informed consent, as the necessity and implications of prenatal diagnosis are not fully contextualized by the couple's carrier status. A third incorrect approach is to dismiss the possibility of carrier status due to a lack of personal or immediate family history of the condition. This overlooks the fact that many individuals can be carriers of autosomal recessive disorders, without any personal or familial manifestation. Ethically, this approach is negligent as it fails to adequately explore potential risks and offer appropriate genetic services, potentially leaving the couple unaware of significant reproductive risks. Professional reasoning. Professionals should approach such situations by systematically gathering all relevant family history information, explaining the principles of autosomal recessive inheritance, and discussing the utility and limitations of carrier screening for both partners. The decision-making process should involve a collaborative discussion with the couple about their concerns, values, and reproductive goals, empowering them to make informed choices about genetic testing and reproductive options. This aligns with the ethical principles of beneficence, non-maleficence, autonomy, and justice, as mandated by professional guidelines. Question 10. Market research demonstrates a growing interest in understanding genetic predispositions for various conditions. A patient presents with a family history suggestive of an X-linked recessive disorder, but they themselves are unaffected. What is the most appropriate approach for the genetic counselor to take in assessing the genetic risk and providing counseling? Option A. Recommend that the patient's unaffected siblings undergo genetic testing to assess their carrier status without further explanation of the inheritance pattern. Option B. Focus on identifying the specific gene mutation associated with the disorder and provide information about its prevalence in the general population. Option C. Advise the patient that since they are unaffected, there is no genetic risk to consider for themselves or their family. Option D. Explain the principles of X-linked recessive inheritance, discuss the patient's potential carrier status, and offer genetic testing for the patient to determine carrier status, followed by a discussion of implications for family members. The correct answer is D. Explain the principles of X-linked recessive inheritance, discuss the patient's potential carrier status, and offer genetic testing for the patient to determine carrier status, followed by a discussion of implications for family members. Explanation. This scenario presents a professional challenge for a genetic counselor due to the inherent complexities of X-linked inheritance patterns and the potential for misinterpretation by patients. The counselor must navigate the delicate balance of providing accurate genetic information while ensuring patient comprehension and autonomy, particularly when dealing with conditions that may have significant implications for family planning and reproductive choices. The challenge lies in translating complex genetic concepts into understandable terms and addressing the emotional and psychological impact of such diagnoses. The correct approach represents best professional practice by prioritizing comprehensive genetic counseling that includes a detailed explanation of X-linked inheritance, carrier status, and the probability of transmission to offspring. This aligns with the ethical principles of informed consent and patient autonomy, ensuring the patient has the necessary information to make informed decisions about their reproductive health and potential genetic testing for family members. Adherence to the American Board of Medical Genetics and Genomics (AB) guidelines emphasizes the importance of clear communication, accurate risk assessment, and the provision of psychosocial support. An incorrect approach that focuses solely on identifying the specific gene mutation without adequately explaining the inheritance pattern fails to meet the core requirements of genetic counseling. This oversight represents a regulatory and ethical failure because it neglects the crucial element of patient education, potentially leading to misunderstanding and anxiety. Another incorrect approach that dismisses the need for further family evaluation based on the initial patient's phenotype is also professionally unacceptable. This is a regulatory and ethical failure, as it overlooks the potential for carrier status in unaffected relatives and the importance of cascade screening, which is a standard practice in genetic service delivery to identify at-risk individuals. A third incorrect approach that relies on anecdotal evidence or non-validated testing methods would be a significant ethical and regulatory failure, violating principles of evidence-based practice and potentially exposing the patient to inaccurate information and inappropriate medical management. The professional decision-making process in such situations should involve a thorough assessment of the patient's understanding, a clear explanation of the genetic principles involved, an accurate risk assessment for the patient and their family, and a discussion of available testing and management options. Professionals should always adhere to established guidelines and ethical codes, ensuring that all recommendations are evidence-based and tailored to the individual patient's needs and circumstances. Question 11. Operational review demonstrates a significant deviation in the allele frequencies of several common single nucleotide polymorphisms, SNP, within a small, geographically isolated human population compared to broader reference populations. This deviation is characterized by an increase in the frequency of certain alleles and a decrease in others, with no clear pattern suggesting positive or negative selection. Given the population's history of limited gene flow and a relatively recent founding event, what is the most appropriate interpretation and subsequent course of action for a medical geneticist? Option A. Conclude that genetic drift, particularly founder effects, is the most likely primary driver of these observed allele frequency changes, and recommend further population-specific genetic studies to identify any alleles associated with increased disease risk or carrier status in this community. Option B. Immediately infer a high prevalence of specific genetic disorders within this population due to the observed allele frequency shifts, and initiate widespread genetic screening programs without further investigation. Option C. Focus solely on identifying potential selective pressures that might explain the allele frequency changes, assuming that drift alone is unlikely to cause such pronounced shifts in multiple loci. Option D. Attribute the allele frequency deviations to random sampling error and disregard them as statistically insignificant, proceeding with standard genetic counseling based on broader population data. The correct answer is A. Conclude that genetic drift, particularly founder effects, is the most likely primary driver of these observed allele frequency changes, and recommend further population-specific genetic studies to identify any alleles associated with increased disease risk or carrier status in this community. Explanation. Scenario analysis. This scenario presents a professional challenge in interpreting population genetic data within the context of a specific, potentially isolated human population. The challenge lies in distinguishing the effects of genetic drift from other evolutionary forces, such as selection or gene flow, and understanding the implications for genetic counseling and public health initiatives. The limited sample size and the potential for founder effects in a relatively isolated community necessitate careful consideration of statistical power and the limitations of inferring population history. Correct approach analysis. The correct approach involves a comprehensive assessment of population genetic data, considering multiple lines of evidence to infer the primary drivers of observed allele frequency changes. This includes evaluating the statistical significance of allele frequency deviations from Hardy-Weinberg equilibrium, assessing patterns of linkage disequilibrium, and comparing allele frequencies with those of larger, related populations. Such an approach aligns with the ethical and professional standards of the American Board of Medical Genetics and Genomics, AB, by ensuring that conclusions are robust, evidence-based, and minimize the risk of misinterpretation that could lead to inappropriate clinical recommendations or public health strategies. It prioritizes accurate scientific inference over simplistic explanations, which is crucial for responsible genetic practice. Incorrect approach is analysis. One incorrect approach would be to solely attribute observed allele frequency changes to genetic drift without considering other potential evolutionary forces. This fails to meet professional standards because it oversimplifies a complex biological phenomenon and ignores the possibility of selection acting on certain alleles, which could have significant implications for disease risk or carrier status. Such a narrow focus could lead to misinformed genetic counseling. Another incorrect approach would be to immediately assume a founder effect and infer a high prevalence of specific genetic disorders based on limited data. While founder effects can contribute to drift in isolated populations, this approach lacks rigorous evidence and could lead to unnecessary alarm or misallocation of resources. It bypasses the necessary analytical steps to confirm the underlying genetic architecture. A third incorrect approach would be to dismiss the observed allele frequency changes as random noise without further investigation. This neglects the potential for significant evolutionary events, including drift, to shape the genetic landscape of a population and impact health outcomes. It represents a failure to engage with the data critically and to apply appropriate population genetic principles. Professional reasoning. Professionals should approach population genetic data with a systematic and evidence-based methodology. This involves 1. Clearly defining the population of interest and its demographic history. 2. employing appropriate statistical methods to analyze allele frequencies, heterozygosity, and patterns of genetic variation. 3. Considering all plausible evolutionary forces, drift, selection, mutation, migration, and designing analyses to differentiate their contributions. 4. Interpreting findings within the context of existing knowledge and acknowledging limitations of the data. 5. Communicating results clearly and accurately, emphasizing the implications for genetic counseling, risk assessment, and potential public health interventions, while avoiding overstatement or speculation. Question 12. Governance review demonstrates that a pediatric patient presenting with global developmental delay, microcephaly, and a history of recurrent infections underwent a chromosomal microarray analysis, CMA. The CMA identified a 1,5 MB deletion on chromosome 17q21, 31, encompassing the cancel-1 gene, and a 2 MB duplication on chromosome XB22, 33, containing several microRNA genes. The clinical geneticist is tasked with interpreting these findings and advising the family. Which of the following represents the most appropriate course of action? Option A. Recommend further targeted genetic testing for specific genes associated with recurrent infections, as the deletion on 17q21, 31 is not definitively linked to immunodeficiency. Option B. Initiate a comprehensive literature review and database search to assess the clinical significance of both the 17q21, 31 deletion and the XB22, 33 duplication in relation to the patient's phenotype, followed by genetic counseling to discuss potential implications and further management strategies. Option C. Counsel the family that the deletion on 17q21, 31 is a known cause of developmental delay and intellectual disability, and the duplication on XB22, 33 is likely benign given its location and gene content, recommending standard developmental follow-up. Option D. Advise the family that the presence of 2 CNVs, regardless of their individual significance, warrants immediate referral to a specialist in rare genetic syndromes for further investigation. Correct answer is A. Recommend further targeted genetic testing for specific genes associated with recurrent infections, as the deletion on 17q21, 31 is not definitively linked to immunodeficiency. Explanation. Scenario analysis. This scenario presents a professional challenge stemming from the interpretation and application of comparative genomic hybridization, CGH, array data in a clinical setting, specifically concerning a pediatric patient with developmental delay and dysmorphic features. The challenge lies in reconciling potentially ambiguous array findings with the clinical presentation and determining the most appropriate next steps for diagnosis and management, while adhering to established professional guidelines and regulatory frameworks relevant to genetic testing in the United States. The need for careful judgment arises from the potential for incidental findings, the implications for family genetic counseling, and the ethical consideration surrounding the disclosure and utilization of genetic information. Correct approach analysis. The correct approach emphasizes a systematic and evidence-based evaluation of the CGH array results in the context of the patient's phenotype. This involves correlating identified copy number variations, CNV, with known genetic syndromes and databases of pathogenic variants. Furthermore, it necessitates considering the clinical significance of any identified CNVs, including whether they are likely to be causative of the observed phenotype or represent benign variants. Crucially, this approach includes appropriate genetic counseling for the family, discussing the findings, their implications for the patient's health and future, and potential testing for family members. This aligns with the standards of practice for genetic testing in the U.S., which prioritize accurate interpretation, patient-centered care, and informed decision-making, as guided by professional organizations like the American College of Medical Genetics and Genomics, ACM. Incorrect approaches analysis. One incorrect approach would be to dismiss the CGH array findings solely because they do not immediately present a clear-cut diagnosis or are not fully concordant with a single, well-defined syndrome. This fails to acknowledge the complexity of genetic contributions to developmental disorders and the possibility of novel or rare CNVs. Ethically, it could lead to a misdiagnosis and delayed appropriate management for the patient. Regulatory failure lies in not fully utilizing the diagnostic potential of the ordered test. Another incorrect approach would be to overemphasize a CNV of uncertain significance without further investigation or careful consideration of its clinical relevance. This could lead to unnecessary anxiety for the family and potentially inappropriate interventions based on speculative findings. This approach risks violating the principle of providing accurate and actionable information, a cornerstone of genetic counseling and testing regulations. A third incorrect approach would be to proceed with invasive or costly follow-up testing without adequate genetic counseling or a clear rationale based on the CGH array data and clinical presentation. This disregards the ethical imperative to avoid unnecessary medical procedures and to ensure informed consent, which is a fundamental aspect of healthcare practice governed by U.S. regulations. Professional reasoning. Professionals should approach such cases by first thoroughly reviewing the CGH array report, paying close attention to the size, location, and gene content of any identified CNVs. This should be followed by a comprehensive literature search and database query, e.g., ClinVar Decipher, to assess the known pathogenicity of these variants. The patient's phenotype should then be meticulously mapped against the genes within the CNVs. Genetic counseling should be an integral part of the process, ensuring the family understands the findings, their implications, and the rationale for any proposed next steps. Decision-making should be guided by a tiered approach, prioritizing clearly pathogenic variants, carefully evaluating variants of uncertain significance with further testing or expert consultation, and considering benign variants as unlikely explanations for the phenotype. Question 13. The assessment process reveals a genetic counselor reviewing exome sequencing data for a patient diagnosed with a rare neurodevelopmental disorder. The analysis identifies a novel variant of uncertain significance, thus, in a gene with a known association with intellectual disability. The counselor must determine the most appropriate way to communicate these findings to the patient and their family, considering the current understanding of the gene and the implications of a VUS. Option A. Inform the patient that the novel variant is definitively the cause of their neurodevelopmental disorder, recommending specific, aggressive therapeutic interventions based on the gene's known function. Option B. Explain that the identified variant is of uncertain significance, detailing what this means in terms of current scientific knowledge, the limitations of the VUS classification, and discussing potential next steps for further investigation or management that align with the patient's clinical presentation and family goals. Option C. Report the variant as benign, as it is novel and therefore unlikely to be pathogenic, and advise the family not to pursue further genetic testing or research. Option D. Provide the patient with a list of all identified variants, including the VUS, without further interpretation or explanation of their potential clinical relevance, stating that the interpretation is the responsibility of the referring physician. The correct answer is B. Explain that the identified variant is of uncertain significance, detailing what this means in terms of current scientific knowledge, the limitations of the VUS classification, and discussing potential next steps for further investigation or management that align with the patient's clinical presentation and family goals. Explanation. The assessment process reveals a scenario where a genetic counselor is faced with interpreting complex genetic findings for a patient with a rare Mendelian disorder. The challenge lies in translating intricate molecular data into clinically actionable information, considering the patient's unique family history, and adhering to the ethical and regulatory standards governing genetic testing and counseling in the United States, as mandated by the American Board of Medical Genetics and Genomics (ABG) exam framework. This requires not only a deep understanding of genetic principles, but also the ability to communicate these principles effectively and ethically within the U.S. healthcare context. The correct approach represents best professional practice because it prioritizes patient autonomy, informed consent, and the accurate dissemination of genetic information. It involves a thorough review of the patient's clinical presentation and family history to contextualize the genetic findings, a clear and understandable explanation of the implications of the identified variant, including penetrance and expressivity, and a discussion of potential management strategies and further testing options. This aligns with the ABG emphasis on evidence-based practice and patient-centered care, ensuring that patients can make informed decisions about their health and reproductive options. The process is guided by principles of beneficence and non-maleficence, ensuring that the genetic information provided is accurate, relevant, and delivered in a manner that minimizes potential harm. An incorrect approach that focuses solely on reporting the raw genetic data without adequate interpretation or patient education fails to meet the professional standards for genetic counseling. This would be a regulatory and ethical failure because it neglects the core responsibility of a genetic counselor to translate complex genetic information into understandable terms for the patient, thereby undermining informed consent and patient autonomy. Another incorrect approach, which involves making definitive prognostic statements without acknowledging the inherent uncertainties in genetic interpretation, particularly for rare variants, is also professionally unacceptable. This can lead to undue patient anxiety or false reassurance, violating the principle of non-maleficence and potentially leading to inappropriate medical decisions. Furthermore, failing to discuss the implications of the findings for at-risk family members without appropriate consent and privacy considerations would represent a breach of ethical obligations and potentially violate privacy regulations. Professionals should employ a decision-making framework that begins with a comprehensive understanding of the patient's clinical context and genetic data. This involves a systematic review of the literature for similar variants, consultation with experts if necessary, and a careful consideration of the patient's values and preferences. The communication strategy should be tailored to the patient's health literacy and emotional state, ensuring that all questions are addressed and that the patient feels empowered to make decisions. Adherence to established guidelines for genetic testing interpretation and reporting, as well as privacy regulations like HIPAA, is paramount. Question 14. Compliance review shows that a medical geneticist has identified a specific genetic variant prevalent in a geographically isolated community, suggesting significant gene flow from an ancestral population. The geneticist is considering how to best disseminate this finding, which, while scientifically important for understanding population genetics, could potentially lead to stigmatization or discrimination against community members if not handled with extreme care. What is the most ethically sound approach for the geneticist to take regarding the dissemination of this gene flow information? Option A. Engage with community leaders and elders to discuss the findings, their potential implications, and collaboratively develop a plan for communicating the information to the broader community in a sensitive and informative manner. Option B. Immediately publish the findings in a high-impact scientific journal to contribute to the broader understanding of human genetic variation and population history. Option C. Share the information directly with individuals within the community who have expressed interest in their genetic ancestry, without broader community consultation. Option D. Withhold the findings entirely to prevent any potential for stigmatization or negative social consequences for the community. The correct answer is A. Engage with community leaders and elders to discuss the findings, their potential implications, and collaboratively develop a plan for communicating the information to the broader community in a sensitive and informative manner. Explanation. Scenario analysis. This scenario presents a professional challenge for a genetic counselor due to the potential for gene flow to impact a vulnerable population. The counselor must balance the scientific imperative of understanding genetic patterns with the ethical responsibility to protect individuals from potential stigmatization or discrimination based on their genetic makeup. The core tension lies in how to ethically disseminate information about a genetic variant that, while scientifically interesting and potentially indicative of gene flow, could also lead to negative social consequences for the community where it is prevalent. The counselor needs to consider the principles of beneficence, non-maleficence, autonomy, and justice in their decision-making. Correct approach analysis. The correct approach prioritizes community well-being and informed consent, aligning with the ethical guidelines of the American Board of Medical Genetics and Genomics (ABM). By engaging with community leaders and stakeholders to discuss the findings and potential implications before broad dissemination, the counselor upholds the principle of justice by ensuring equitable consideration of the community's needs. This collaborative approach respects the autonomy of the community by allowing them to have a voice in how information that directly affects them is shared. It also embodies non-maleficence by proactively mitigating potential harm, such as stigmatization or discrimination, that could arise from uncontextualized or poorly managed disclosure of gene flow information. This aligns with the ABM emphasis on responsible communication of genetic information and consideration of societal impact. Incorrect approach is analysis. One incorrect approach involves immediately publishing the findings in a peer-reviewed journal without prior community consultation. This fails to uphold the principle of non-maleficence by potentially exposing the community to harm without their knowledge or consent. It also disregards the principle of justice by prioritizing scientific publication over the welfare of the affected population. Such an action could be seen as a breach of trust and could lead to unintended negative consequences for the community, violating ethical standards for genetic professionals. Another incorrect approach is to withhold the information entirely due to fear of stigmatization. While motivated by a desire to protect, this approach violates the principle of beneficence by denying the community potentially valuable information about their genetic heritage, which could have implications for health or ancestry. It also undermines the scientific pursuit of knowledge, which, when handled ethically, can benefit society. The ABM guidelines encourage responsible disclosure, not outright suppression of scientifically relevant findings. A third incorrect approach is to share the findings only with a select few individuals within the community without a broader, structured discussion. This could lead to misinformation, selective disclosure, and potential social stratification within the community. It fails to ensure equitable access to information and does not provide a mechanism for collective understanding or decision-making, thus violating principles of justice and potentially causing harm through incomplete or biased communication. Professional reasoning. Professionals should adopt a phased approach that begins with internal review and ethical consultation. This should be followed by engagement with community leaders and relevant stakeholders to explain the findings, discuss potential implications, and collaboratively develop a communication strategy. This process ensures that the community's concerns are addressed, their autonomy is respected, and the information is disseminated in a responsible and culturally sensitive manner, aligning with the ethical obligations of genetic professionals. Question 15. Operational review demonstrates a patient presents with a family history of a known autosomal dominant condition, but the patient themselves exhibits only very subtle, non-specific symptoms that are difficult to definitively attribute to the condition. The genetic counselor is tasked with assessing the patient's risk and providing appropriate counseling. Which of the following approaches best addresses the complexities of penetrance and expressivity in this scenario? Option A. Focus solely on the patient's current symptoms, advising that if the symptoms do not worsen, there is no immediate cause for concern regarding a genetic predisposition. Option B. Inform the patient that since the condition is autosomal dominant, they either have it fully or not at all, and their current mild symptoms are likely unrelated to the family history. Option C. Explain that due to the patient's minimal symptoms, the likelihood of inheriting the condition is very low, and further genetic testing is likely unnecessary. Option D. Discuss the concepts of reduced penetrance and variable expressivity, explaining that the patient may carry the genetic mutation without full phenotypic manifestation or may exhibit a milder form of the condition, and recommend appropriate genetic testing and follow-up based on these possibilities. The correct answer is C. Explain that due to the patient's minimal symptoms, the likelihood of inheriting the condition is very low, and further genetic testing is likely unnecessary. Explanation. Scenario analysis. This scenario presents a professional challenge in genetic counseling due to the inherent complexities of penetrance and expressivity. A genetic counselor must accurately interpret and communicate these concepts to a patient, especially when a family history suggests a genetic condition, but the patient's phenotype is mild or absent. Misinterpreting these concepts can lead to significant patient anxiety, inappropriate medical management, and a failure to provide adequate genetic risk assessment for the patient and their relatives. The challenge lies in translating abstract genetic principles into understandable and actionable information for a patient. Correct approach analysis. The correct approach involves a thorough assessment of the available clinical and genetic information, coupled with a clear explanation of penetrance and expressivity. This includes discussing the probability of an individual with a specific genotype manifesting the phenotype penetrance, and the range of phenotypic variation observed among affected individuals expressivity. This approach aligns with the ethical principles of beneficence and autonomy, ensuring the patient receives accurate information to make informed decisions about their health and reproductive choices. It also adheres to professional guidelines that mandate comprehensive genetic counseling, including the explanation of genetic risk factors and their implications. Incorrect approaches analysis. One incorrect approach would be to dismiss the possibility of a genetic condition solely based on the patient's lack of overt symptoms, ignoring the possibility of reduced penetrance. This fails to acknowledge that a genetic predisposition may exist without a full clinical manifestation, potentially leading to misdiagnoses and inadequate risk assessment for family members. This approach violates the principle of non-maleficence by potentially withholding crucial information. Another incorrect approach would be to overemphasize the mildness of symptoms in other family members as definitive proof that the patient will not be affected, without adequately explaining the concept of variable expressivity. This can lead to a false sense of security and prevent appropriate monitoring or preventative measures. This approach undermines patient autonomy by providing incomplete information for decision-making. A third incorrect approach would be to provide a simplistic yes or no answer regarding the patient's genetic status without a nuanced discussion of penetrance and expressivity. This oversimplification fails to capture the probabilistic nature of genetic conditions and the spectrum of clinical presentations, leading to potential misunderstandings and misinformed decisions. This is a failure of professional duty to provide comprehensive genetic counseling. Professional reasoning. Professionals should approach such situations by first gathering all relevant clinical and genetic data. This includes detailed family history, personal medical history, and any available genetic testing results. Subsequently, the counselor must synthesize this information, considering the known inheritance patterns, penetrance, and expressivity of the suspected condition. The communication strategy should be tailored to the patient's understanding, using clear language and visual aids if necessary. The decision-making process should prioritize patient education, informed consent, and the provision of accurate, comprehensive risk assessment, empowering the patient to make autonomous choices regarding their health and family planning. Question 16. Stakeholder feedback indicates a need to enhance diagnostic capabilities for complex pediatric genetic disorders. A laboratory is considering adopting single nucleotide polymorphism, SNP, array technology as a primary diagnostic tool for these conditions. Which of the following approaches best aligns with the regulatory framework, laws, and guidelines for the American Board of Medical Genetics and Genomics, ABG, in this context? Option A. Immediately deploy the SNP array technology for all relevant pediatric cases to leverage its advanced capabilities, assuming its widespread use in research implies clinical readiness. Option B. Prioritize the acquisition of the most advanced SNP array platform available, with the intention of refining interpretation and quality control measures post-implementation based on initial clinical findings. Option C. Implement the SNP array technology after conducting thorough analytical validation studies to establish its performance characteristics and developing clear interpretive guidelines aligned with current clinical knowledge and ABG reporting standards. Option D. Introduce the SNP array technology with minimal upfront validation, relying primarily on vendor-provided performance data and updating consent forms only for general genetic testing. The correct answer is C. Implement the SNP array technology after conducting thorough analytical validation studies to establish its performance characteristics and developing clear interpretive guidelines aligned with current clinical knowledge and ABG reporting standards. Explanation. This scenario presents a professional challenge in balancing the rapid advancement of genomic technologies with the established regulatory and ethical frameworks governing their clinical application. The core difficulty lies in ensuring that new methodologies, such as SNP arrays, are integrated into diagnostic workflows in a manner that is both scientifically sound and compliant with the standards set by the American Board of Medical Genetics and Genomics, ABG. This requires a deep understanding of the analytical validity, clinical utility, and reporting standards for these technologies, as well as adherence to guidelines concerning informed consent, data interpretation, and patient counseling. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based integration of SNP array technology. This involves rigorous validation of the assay's performance characteristics, including sensitivity, specificity, and accuracy, against established benchmarks. Furthermore, it necessitates the development of clear protocols for data interpretation, ensuring that findings are contextualized within the patient's clinical presentation and relevant scientific literature. Adherence to ABM guidelines for reporting genetic test results, which emphasize clarity, completeness, and the inclusion of actionable information for patient management, is paramount. This approach ensures that the introduction of SNP arrays enhances diagnostic capabilities without compromising patient safety or the integrity of genetic services. An incorrect approach that focuses solely on adopting the newest SNP array technology without adequate validation would represent a significant regulatory and ethical failure. The ABM, like other professional bodies, expects genetic testing to be performed using methods that have demonstrated analytical and clinical validity. Introducing unvalidated tests risks generating inaccurate or misleading results, which can lead to misdiagnosis, inappropriate clinical management, and harm to patients. This violates the ethical principle of beneficence and non-maleficence. Another incorrect approach, such as implementing SNP arrays without updating informed consent procedures to reflect the specific capabilities and limitations of the technology, would also be a regulatory and ethical lapse. Patients must be fully informed about the type of genetic information that will be generated, the potential implications of the findings, and the uncertainties associated with the test. Failure to do so undermines the principle of patient autonomy and can lead to breaches of trust. Finally, an approach that bypasses established quality control and proficiency testing for SNP array analysis would be a direct violation of regulatory expectations for laboratory practice. The ABM emphasizes the importance of ongoing quality assurance to ensure the reliability and accuracy of genetic testing. Neglecting these measures compromises the integrity of the laboratory's output and jeopardizes patient care. The professional decision-making process for similar situations should involve a multifaceted evaluation. First, assess the scientific merit and evidence base for the proposed technological advancement. Second, meticulously review relevant ABM guidelines and any applicable federal or state regulations pertaining to genetic testing and laboratory practice. Third, consider the ethical implications, including informed consent, patient privacy, and the potential for diagnostic or prognostic uncertainty. Fourth, engage in robust internal validation and quality assurance processes before clinical implementation. Finally, ensure comprehensive training for laboratory personnel and clinicians involved in the interpretation and communication of results. Question 17. The risk matrix shows a germline pathogenic variant identified incidentally in a patient undergoing somatic tumor profiling for metastatic breast cancer. This variant is associated with an increased lifetime risk of hereditary cancer syndromes, including an elevated risk for ovarian and pancreatic cancer in first-degree relatives. The patient is a 55-year-old female with 2 adult children. The genetic counselor has confirmed the variant's pathogenicity and its implications for family members. What is the most appropriate next step for the genetic counselor? Option A. Directly contact the patient's adult children to inform them of the genetic finding and offer genetic counseling and testing, as it is in their best interest. Option B. Obtain explicit consent from the patient to contact her adult children to inform them of the genetic finding and offer genetic counseling and testing. Option C. Advise the patient to inform her adult children herself, without offering further assistance or support from the genetic counseling team. Option D. Document the finding and its familial implications in the patient's medical record, but take no further action regarding potential disclosure to relatives. Correct answer is B. Obtain explicit consent from the patient to contact her adult children to inform them of the genetic finding and offer genetic counseling and testing. Explanation. Scenario analysis. This scenario presents a common challenge in cancer genomics, where a germline variant identified incidentally during somatic tumor profiling has potential implications for the patient's family. The professional challenge lies in balancing the patient's autonomy and privacy with the potential benefit of informing at-risk relatives, while adhering to professional guidelines and legal frameworks governing genetic information. The complexity arises from the need to navigate patient consent, potential familial cascade testing, and the ethical considerations of disclosing information that may impact individuals who have not directly consented to testing. Correct approach analysis. The correct approach prioritizes patient autonomy and confidentiality while facilitating responsible disclosure. Obtaining explicit consent from the patient to contact potentially at-risk relatives is paramount. This aligns with the principles of informed consent and patient privacy as outlined by professional genetic counseling standards and relevant U.S. regulations, e.g., HIPAA. It respects the patient's right to control their genetic information and empowers them to decide how and if this information is shared. This approach also supports the ethical principle of beneficence by enabling at-risk relatives to access potentially life-saving genetic information and interventions, but only with the patient's permission. Incorrect approaches analysis. One incorrect approach involves directly contacting the patient's adult children without their parents' explicit consent. This violates the patient's right to privacy and confidentiality, potentially breaching HIPAA regulations. It also undermines patient autonomy by circumventing their decision-making authority regarding their genetic information. Furthermore, it could damage the patient-clinician relationship and create legal liabilities. Another incorrect approach is to do nothing and not inform the patient of the potential familial implications of the germline variant. While this respects patient privacy in the immediate sense, it fails to uphold the principle of beneficence by withholding potentially crucial health information from at-risk family members. Professional guidelines often encourage genetic counselors to discuss the implications of germline findings for family members and to explore options for disclosure, even if the ultimate decision rests with the patient. A third incorrect approach is to unilaterally decide to disclose the information to the family, believing it is in their best interest. This disregards the patient's autonomy and right to control their genetic information. It also fails to consider the complex family dynamics or the patient's potential reasons for not wanting to disclose the information, which could include fear of stigma, discrimination, or familial conflict. This action would be a clear violation of ethical principles and potentially legal statutes. Professional reasoning. Professionals should employ a systematic approach that begins with a thorough understanding of the genetic finding and its implications. This includes assessing the penetrance, expressivity, and available management strategies for the associated condition. The next step involves a comprehensive discussion with the patient about the germline finding, its potential impact on their health, and importantly, its implications for their family members. This discussion should explore the patient's comfort level with disclosure, potential barriers, and the available options for facilitating cascade testing, such as providing educational materials for the patient to share or offering to contact relatives with the patient's consent. The professional's role is to educate, support, and empower the patient to make informed decisions that align with their values and preferences, while also considering the ethical imperative to facilitate access to genetic information for at-risk individuals when appropriate and consented to. Question 18. The efficiency study reveals that a genetic testing laboratory's interpretation of a newly identified variant in a gene associated with a suspected autosomal recessive condition is being questioned. The laboratory's initial report suggests the variant is pathogenic based on its presence in a homozygous state in an affected individual, aligning with a simple Mendelian recessive inheritance model. However, subsequent family studies indicate incomplete segregation with the phenotype, with some heterozygous carriers exhibiting mild symptoms and some homozygous individuals showing no symptoms. Which of the following approaches best aligns with regulatory compliance and best practices for reporting genetic findings in the United States, considering the complexities of Mendelian inheritance? Option A. Immediately halt all testing for this gene and issue a general recall of all previous reports for this disorder until a definitive inheritance pattern can be established. Option B. Issue an amended report that clarifies the observed incomplete penetrance and variable expressivity and reevaluates the variant's pathogenicity based on a broader set of evidence, including population data, in silico predictions, and functional studies, while maintaining the initial report's findings as a strong indicator of pathogenicity in the homozygous state for the specific phenotype observed. Option C. Maintain the original report's conclusion of pathogenicity, attributing the discrepancies to potential misdiagnosis in family members or environmental factors, without further investigation or amendment. Option D. Reclassify the variant as benign due to the lack of perfect segregation, and issue an amended report to all affected families. The correct answer is D. Reclassify the variant as benign due to the lack of perfect segregation, and issue an amended report to all affected families. Explanation: the efficiency study reveals a discrepancy in the interpretation of Mendelian inheritance patterns for a rare autosomal recessive disorder within a clinical genetics practice. The challenge lies in ensuring that diagnostic reports and genetic counseling accurately reflect current understanding of Mendelian genetics, while adhering to the regulatory framework governing genetic testing and reporting in the United States, as overseen by bodies like the FDA for laboratory-developed tests and CLIA for laboratory quality. Misinterpretation can lead to incorrect risk assessments for families, impacting reproductive decisions and clinical management. The correct approach involves a thorough review of the diagnostic methodology, variant interpretation, and the established inheritance pattern of the disorder. This includes consulting peer-reviewed literature, utilizing reputable variant databases, and applying established guidelines for variant classification, e.g., ACNC/AMP guidelines. This ensures that the reported genotype-phenotype correlation is robust and aligns with the principles of Mendelian inheritance, thereby providing accurate and actionable information to patients and referring physicians, which is a core requirement of CLIA and professional ethical standards for genetic testing. An incorrect approach would be to rely solely on a single, older publication or anecdotal evidence to establish the inheritance pattern, especially for a rare disorder where new data may have emerged. This fails to meet the standard of care for variant interpretation and reporting, potentially violating CLIA regulations regarding the accuracy and reliability of laboratory test results. Another incorrect approach would be to oversimplify the interpretation by assuming complete penetrance and expressivity without considering potential modifying factors or incomplete penetrance, which are known phenomena in Mendelian genetics and can lead to misdiagnosis or misdiagnoses, contravening the ethical obligation to provide comprehensive and accurate genetic information. A third incorrect approach would be to communicate findings without clearly delineating the level of evidence supporting the Mendelian inheritance pattern, potentially misleading families about the certainty of their genetic risk, and violating the principles of informed consent and transparent communication. Professionals should employ a systematic decision-making process that prioritizes evidence-based interpretation, adherence to established guidelines, and clear, accurate communication. This involves a multi-step review of genetic data, consultation with experts if necessary, and a commitment to continuous learning to stay abreast of evolving knowledge in Mendelian genetics and its clinical implications. Question 19. The audit findings indicate that a genetic counselor's approach to communicating a moderate-risk genetic finding to a patient was deemed insufficient. Which of the following approaches best reflects the recommended practice for risk assessment and communication in this scenario, according to established genetic counseling professional guidelines? Option A. The counselor should have focused exclusively on the molecular details of the genetic variant and its inheritance pattern, assuming the patient possessed a strong background in genetics. Option B. The counselor should have begun by asking the patient about their understanding of genetic risk and their personal concerns, then tailored the explanation of the genetic finding and its implications using clear, understandable language, and facilitated a discussion about potential management options and the patient's preferences. Option C. The counselor should have immediately presented the raw statistical probability of the genetic finding and its associated risks without further elaboration to ensure the patient received the unvarnished data. Option D. The counselor should have minimized the discussion of the genetic finding, emphasizing that the risk was not definitive and that further testing might be available to avoid causing undue worry. The correct answer is B. The counselor should have begun by asking the patient about their understanding of genetic risk and their personal concerns, then tailored the explanation of the genetic finding and its implications using clear, understandable language, and facilitated a discussion about potential management options and the patient's preferences. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a genetic counselor to balance the imperative of providing comprehensive risk information with the potential for causing undue anxiety or distress to a patient. The audit findings highlight a gap in the counselor's communication, suggesting a need for more nuanced and patient-centered risk assessment and communication strategies. The challenge lies in translating complex genetic probabilities into understandable and actionable information without overwhelming the patient or leading to misinterpretations that could impact their healthcare decisions. Correct approach analysis. The correct approach emphasizes a collaborative and iterative process of risk assessment and communication. It involves eliciting the patient's understanding, values, and concerns before presenting information, tailoring the explanation to their comprehension level, and using clear, non-technical language. This approach aligns with the ethical principles of autonomy and beneficence, ensuring that the patient can make informed decisions about their genetic health. It also adheres to professional guidelines that advocate for patient-centered care and effective communication of genetic risk information, promoting shared decision-making. Incorrect approach is analysis. One incorrect approach involves presenting raw statistical probabilities without context or consideration for the patient's emotional state or prior knowledge. This fails to meet the ethical obligation of beneficence by potentially causing significant distress and anxiety without adequate support or explanation. It also undermines patient autonomy by not ensuring true comprehension, which is a prerequisite for informed decision-making. This approach can be seen as a failure to adhere to professional standards of clear and empathetic communication. Another incorrect approach is to oversimplify the risk to the point of downplaying its significance, thereby failing to provide a complete picture of potential implications. This violates the principle of veracity and can lead to a patient making suboptimal healthcare choices due to a lack of awareness of potential risks. It also fails to uphold the counselor's duty to inform, which is a cornerstone of genetic counseling practice. A third incorrect approach might be to focus solely on the technical aspects of the genetic finding without exploring the psychosocial impact or the patient's personal context. This neglects the holistic nature of genetic counseling, which extends beyond the biological implications to encompass the individual's lived experience and decision-making capacity. Such an approach can lead to a disconnect between the genetic information provided and the patient's ability to integrate it into their life. Professional reasoning. Professionals should approach risk assessment and communication by first establishing rapport and understanding the patient's perspective. This involves active listening and open-ended questioning to gauge their current understanding, concerns, and values. Subsequently, genetic information should be presented in a clear, concise, and understandable manner, using appropriate visual aids or analogies if helpful. The counselor must be prepared to explain the implications of the risk in the context of the patient's family history, personal health, and available management options. Crucially, the process should be iterative, allowing for questions, clarification, and emotional support throughout. Professionals must continuously assess the patient's comprehension and adjust their communication accordingly, ensuring that the patient feels empowered and supported in their decision-making process. Question 20. The performance metrics show that a novel CRISPR-Cas9 gene editing strategy designed to correct the specific mutation causing a severe, progressive neuromuscular disorder in a pediatric patient has demonstrated high on-target editing efficiency and minimal off-target edits in preclinical cell line models. The patient's condition is deteriorating rapidly, and current standard of care treatments offer only palliative support. The research team is considering administering this experimental therapy directly to the patient. What is the most appropriate next step in the decision-making process? Option A. Defer the CRISPR-Cas9 therapy indefinitely until more extensive long-term human data becomes available for similar gene editing applications to ensure absolute certainty of safety. Option B. Initiate a comprehensive review of all available preclinical data, including in vivo studies if any exist, to assess potential risks such as mosaicism and immunogenicity, and engage in detailed discussions with the patient's guardians regarding the experimental nature, potential benefits, uncertainties, and risks of the proposed therapy, while simultaneously preparing for rigorous post-treatment monitoring. Option C. Administer the CRISPR-Cas9 therapy without extensive discussion of risks, focusing primarily on the potential for a cure, to avoid overwhelming the patient's guardians with complex scientific details. Option D. Proceed with the CRISPR-Cas9 therapy immediately, given the patient's critical condition and the promising in vitro results, to maximize the chance of therapeutic intervention before further deterioration. The correct answer is B. Initiate a comprehensive review of all available preclinical data, including in vivo studies if any exist, to assess potential risks such as mosaicism and immunogenicity, and engage in detailed discussions with the patient's guardians regarding the experimental nature, potential benefits, uncertainties, and risks of the proposed therapy, while simultaneously preparing for rigorous post-treatment monitoring. Explanation. Scenario analysis. This scenario presents a common challenge in clinical genetics where a novel CRISPR-Cas9 application is being considered for a patient with a rare genetic disorder. The challenge lies in balancing the potential therapeutic benefit against the inherent risks and the evolving regulatory landscape for gene editing technologies. Professionals must navigate the ethical imperative to offer potentially life-saving treatments while adhering to stringent safety and efficacy standards, especially given the irreversible nature of germline or somatic gene modifications. The lack of extensive long-term data for this specific application further complicates the decision-making process, requiring a thorough risk-benefit assessment grounded in the best available scientific evidence and ethical guidelines. Correct approach analysis. The correct approach prioritizes patient safety and informed consent, aligning with the core principles of medical ethics and the regulatory framework governing novel therapies. This involves a comprehensive review of preclinical data, rigorous assessment of potential off-target effects and mosaicism, and a clear, detailed discussion with the patient and their family about the uncertainties, risks, and potential benefits. Establishing a robust monitoring plan post-intervention is also crucial for tracking efficacy and identifying any adverse events. This approach reflects best professional practice by adhering to the precautionary principle, ensuring patient autonomy through informed consent, and maintaining transparency with regulatory bodies. The American Board of Medical Genetics and Genomics, AB, emphasizes evidence-based practice and ethical conduct, which this approach embodies by prioritizing patient well-being and responsible innovation. Incorrect approaches analysis. One incorrect approach involves proceeding with the CRISPR-Cas9 therapy based solely on promising preliminary in vitro data, without adequate in vivo validation or a thorough risk assessment. This fails to meet the standard of care for experimental therapies, as it disregards the potential for unforeseen complications in a living organism, such as immunogenicity or off-target edits that could lead to oncogenesis. Ethically, this bypasses the requirement for a robust demonstration of safety and efficacy for human application, potentially violating the principle of non-maleficence. Another incorrect approach is to delay or refuse treatment indefinitely due to the novelty of the technology, even when the patient's condition is severe and lacks alternative therapeutic options. While caution is warranted, an absolute refusal without exploring all avenues for safe and ethical application, including well-designed clinical trials, could be seen as failing the principle of beneficence. This approach neglects the potential to alleviate suffering and improve quality of life for the patient. A third incorrect approach is to proceed with the therapy without obtaining comprehensive informed consent, particularly regarding the experimental nature of the treatment and the potential for unknown long-term consequences. This violates patient autonomy and the ethical requirement for transparency. Regulatory bodies would also scrutinize such a lack of informed consent, as it undermines the integrity of the research and clinical application process. Professional reasoning. Professionals should approach such complex cases by first conducting a thorough literature review and consulting with experts in gene editing and the specific disease. A multidisciplinary team, including geneticists, bioethicists, and regulatory specialists, should evaluate the available preclinical and clinical data. The decision-making process should be guided by a risk-benefit analysis that is transparently communicated to the patient and their family, ensuring that informed consent is obtained. If the therapy is deemed potentially beneficial and acceptably safe, it should ideally be pursued within the framework of a regulated clinical trial or under strict compassionate use protocols, with robust monitoring and data collection. This systematic and ethical approach ensures that patient welfare remains paramount, while advancing the responsible application of novel genetic technologies.